Hello everyone, welcome to MediSNAPS, Completing Healthcare. This video is basically a complete guidance for the parents regarding the COVID situation. This series is brought to you in collaboration with babyhelp.in. Today we have with us a very special guest, Dr.Sandip Gupta, who's a senior pediatrician and a child care expert practicing in Bangalore. A very warm welcome to you, sir. When should the parents go for the COVID test in children? Like if a child is having a fever, we should wait or just get them tested right away?
So the answer is, unless you feel like the child is having symptoms which are severe, you should not do for every child who's turning out to having a fever. So fever more than 3 days, or there is breathing difficulty or fast breathing, or the child is too lethargic or sick, in that case we are doing corona test. Another thing which requires corona test is if the parents or elderly people in the home are becoming COVID positive. So if the household people are actually COVID positive, then it is mandatory to do COVID test for children also, or the child has come into contact of somebody who is turned out to be COVID positive. In that case, we are doing COVID test. And now coming to the tests, what COVID tests are actually recommended. So ideal test is basically RT-PCR COVID test, which is very high sensitivity and specificity. So if it turns positive, then mostly you are COVID positive, and if it turns negative, most of the times you are COVID negative. But there are few instances where actually patients have had symptoms and the test has turned negative, but that is an exception and that is to be handled by the doctors. But as such, in general, RT-PCR tests are the gold standard right now. Apart from that, nucleic amplification tests also are good, and they also are yielding a very high sensitivity and specificity, so they are also good tests. Then apart from this, one more test is there available in market, that is rapid antigen test, that is less costly and gives a rapid result. So it gives immediate results, which is sometimes done on the kit. So these results, if they turn positive, then definitely you have coronavirus, but if they turn negative, they are not very sure whether you are corona positive or not positive. Even with the presence of coronavirus infection, you may turn negative with this rapid antigen test. So that is the disadvantage of rapid antigen test. So you have to, if you have turned negative with the rapid antigen test and still having symptoms which may match the profile of coronavirus infection, in that case you may need to go for a RT-PCR test.
Thank you so much, sir, for the wonderful information. Do check Dr. Sandip Gupta's website and social media handlings for any further queries. Link is in the description. Do like, share and subscribe to our YouTube channel and hit the bell icon not to miss the further updates.